I'm Steph Schlueter. I'm an emergency physician. I work as the co-director of emergency medicine down at Peel Health Campus, and I also work for the WA Country Health Service, so I usually wear multiple different hats. And I've got Damien here with me today from the college, who will introduce himself in a very short moment. So we're going to give you a bit of an overview of just a 10-minute taste of emergency medicine. And that's certainly what I would look like about 10 years ago, before I started. So was it for me? Why should it be for you? Why was it for me? Well, you know, it's a variety of clinical practice. You see neonates, you see pregnant patients, you see very old patients, you see very disturbed patients, you see patients at their most critical time of their life. So it's a privilege to look after them. We are herd animals. Emergency medicine is a team sport, just like any other critical care specialty, really. As resuscitationists, we work together. We're there for each other because it's a special environment. We're a jack of all trades, so if you like procedures, you get your fair share of procedures. If you like medicine and the tricky bits, you also get that. If you like to work in the city, you can do that. If you like to work out in Alice Springs, out in Kalgoorlie, Broome, the Kimberley, you can do that as well. You don't just have to work clinically, you can do lots of other stuff. So, and as a trainee, it's fantastic because the training program is relatively short. It's a variety, again, ED and non-ED stuff, from anaesthetics over to critical care, over to non-ED skills such as education, toxicology, ultrasound, hyperbaric, pick what you like. So, what does it look like, a day in ED? It's very variable. It really is, and it depends on where you work. But like I said, this is just a bit of a taste. And sometimes you don't get necessarily lots of million procedures in one day, but you will see these very frequently throughout your careers. And it's a different pace, going from a shoulder reduction to a full-blown cardiac arrest to maybe delivering a baby in the car park. You can get that. And lots of other stuff. But I think the really nice thing, what I really do like about it, is that at the end of the day I can hand over my patients and I can go home. I don't have any other commitments. Another really, really fascinating thing is the subspecialties and the skills, such as, you know, retrieval, pre-hospital, toxicology, like I mentioned, hyperbaric, event medicine. It gives you, you know, you're a jack of all trades. You can do any type of specialty, subspecialty afterwards. And you can work rural and remote. You can also do dual training in paediatrics, anaesthetics, ICU, GP. So it provides you with quite a bit of a nice background. And then there's the lifestyle. You can practice anywhere in the world, really. You can combine it with one of your hobbies. If you like skiing, you can go as a ski doctor to Queenstown, like one of my very, really good friends after her fellowship went 6 months down to Queenstown in New Zealand. You can work on the coast, you can work remotely, and you have to kind of like shift work. I like to be on the beach on Monday morning when everyone else is in the office. So, but it's not for everyone. We absolutely recognise that, but if you want to know a little bit more, want to have a chat to myself or Candice, who's down here as another fellow, then please come and see us at the booth. And Damien is going to give you a bit of an overview of how to get in that.
So my name's Damien, I'm the General Manager at the college, so I actually look after the administration of the program itself. So I'm going to tell you a little bit about the program, its structure and how to get in for those that are interested, particularly getting into next year. So the program itself is 5 years full-time equivalent. So the first 12 months is what we call provisional training, and then you do 48 months of advanced training. To do that, you've got 12 years in total. You can be flexible with that. There's 2 years of interruption you can do. You can do part-time training. You don't have to apply for that. So you can do a 0.75. You can do concurrent training. We have a number of trainees who do 0.5 ED and 0.5 medical administration, and both of those count towards their overall training program. As Steph mentioned, you do a number of non-ED terms. You can do up to 18 months of non-ED, and that can be in anything. So all the other colleges are out there. You can do any of those non-ED skills. As was mentioned, you never know what's going to come through the door of ED, so that's why we encourage the more non-ED skills, and I'll talk about that as part of selection a bit later. The other part of it is you do 6 months of critical care, and that involves either ICU or anaesthetics. You can also use the non-ED to do ICU and anaesthetics as well. So if you've got a particular interest in ICU, which a lot of our ED trainees do, you can use the non-ED terms to do some of that as well. As I mentioned, 2 years of interruption to training. We also have a generous parental leave policy as well. So on top of the interruption to training, you can actually add parental leave onto that and incorporate that within your training. The other part of the difference between our program is you actually find your own placements. So we don't have a limited number of training positions that are on offer, so it's actually not necessarily a competitive process. I'll talk about that shortly. But you find your own, which allows you to have the flexibility to move around. You can move around within your own state, you can move interstate, you can move to New Zealand and complete your training, because you find that. And you can even go overseas. So some of your overseas training can actually count towards non-ED. So we have a number of trainees who go over to the UK, for example, work in ED placements over there and can count towards their non-ED training. So they're getting a bit more experience and variety rather than being in one city. At all these sites, you have a Director of Emergency Medicine Training. So they guide you through the training. They do your in-training assessments, which I'll talk about shortly. So there's someone there to guide you as well of all the fellows in the college. So this is a structure of the program. On the right is the time. Just in terms of the assessments and so on, during provisional training you do what we call ITA, so you're assessed and given feedback by your DEMT. Unfortunately there are exams, there's 4 of them in total throughout the program. 2 at provisional training are written and a viva, and 2 towards the end are written and an OSCE. There's a research requirement that everybody has to do. You can do that through a project, or you can actually do that via coursework. We have a prescribed list of courseworks, part of master's programs, so you have the option to do it that, and about 90% of our trainees actually use that option. There's also about a paediatric requirement as well, so you can do that through a logbook, you can do that through a 6 months ED term in a paediatric hospital. In terms of selection, so those people looking to get in next year, you probably need to get organised now. Essentially you need general registration, you need to be able to work in Australia and New Zealand. The thing you do need to get organised though, if you are looking to apply for next year in particular, is you do need to have an ED term in PGY2. Okay, you will do one in PGY1 as part of your intern requirements, but you do need one in PGY2 as well. From that term we actually get all your references, and I'll talk about that in a second. The other thing you need to do is a couple of non-ED terms in PGY1 at a minimum, but we actually encourage you to do as many as you can. As was mentioned, you never know what's going to come through the door of an ED, so you need to be prepared. It also gives you an insight for when you're moving patients out of the ED onto the wards and you're talking to other consultants from other specialties as well. So we really encourage a lot of non-ED terms in different areas. How it works, there is an application fee required at the time. You also complete a structured CV. So what we're looking for is all the courses that you've done that are ED related, so the ALS for example. Other training you may have done, other activities you may have done, and that can be non-medical as well. So if you've got a high degree in music or language, or you're a president of a sporting club or some high achieving sporting thing you've done, that's also part of your CV, and we'll look at that as well. The ED term in PGY2, so you're looking for 4 selection references. They've got to be Director of Emergency Medicine Training, a couple of fellows, and even the senior nurse is often used as a reference. They fill out a form against criteria against our curriculum, and what they do and contribute towards is a selection subcommittee reviewing that and see whether you're suitable to training in the training program and a career in emergency medicine. And it could be that they may recommend that you're not quite ready yet and may wait another year. You do get feedback though if you're unsuccessful on the areas that you may need to work on for a future application. There is no interview and there is no quota. So if you make the grade you're in, as I said, you're finding your own placement. So there is no quota. And what you do is you begin training at the start of the medical training year, which is February for WA. Should be one more. It's not working. It's frozen us.
Yep.
It's not me. There we go. So those people who are looking to start next year, these are the dates. All your eligibility requirements must be met by the time of the application closing date. That's why you need to get organised with your ED term in PGY2. That's the dates for next year to start in 2020. And there'll be similar dates for future rounds moving forward as well. So that's it. That's all the time we kind of have. Is there any questions at all? So you can apply in round 1 or round 2. They're just rounds in terms of handling the administration. There's no difference, but it won't make any difference to your start date. You always start in the following training year. So if you don't have an ED term by the time of the closing date of round 1, you can apply for round 2.
To apply for the ED training career pathway, do we necessarily have to secure an employment with some sort of particular hospitals, as in other training pathway? You
don't have to have a secure position by the time you actually apply, but by the time of the start of the training year, you'd want to start straight away. You can, though, go on an interruption to training straight away if you don't have a position set up.
So it doesn't necessarily have to be like that. We have to secure, we have to be employed by some sort of particular hospital or government body to be eligible for the ED training.
You just need to find a registrar position ready for the start of the training year. And then you can actually start in non-ED, you don't have to start in ED. So in provisional training in the first 12 months, it can be made up of, it's got to be made up of a minimum of 6 months of ED, but it can also be 6 months of non-ED, or it can be 12 months of ED. You've got that flexibility. So if you can't find an ED position straight away, you may be able to find a non-ED position, and that'll contribute towards your provisional training requirements.
And in terms of the application, for an applicant who've done a variety of rotations, in comparison with an applicant who did quite a long time in ED, such as maybe 6, 8, 10 months in ED, in comparison with a candidate who did variety of rotations, which candidate would probably have more chance of getting into the training program?
The one who done the non-ED. Yeah. Because the one who does the more non-ED rotations you do, the more points you'll end up scoring.
Yeah. And
what the ED term will give you is the opportunity to actually boost your CV part, where you might actually be able to contribute to some quality projects or audits or that kind of activity within the ED department to show your suitability and your enthusiasm for ED.
Yeah. And to be eligible, we only need 3 months of ED placement, right?
To be eligible?
To be eligible to apply for this training program.
Yeah, you need just 1 ED term in PGY2.
Yeah.
That's it.
Yeah.
As a minimum. And then the 2 non-ED terms. That's the minimum you're required to do. 2 non-ED terms.
Non-ED terms.
And then 1 ED term in PGY2.
Yeah.
At a minimum.
Yeah. Thank you very much.
No worries. Not at this stage. Not at this stage. There's no quota, because we don't have training positions. So at this stage, no.
Seeing as you don't have specific training positions, how have you had many trainees have difficulty finding registrar positions?
We had, I think it was about 283 people start this year, and I think only a couple of them went straight onto an interruption to training. The rest all found positions.
So once you become a fellow of the college, is that membership reciprocal with the New Zealand college as well?
We are both Australia and New Zealand.
We're one college.
Yeah, we're one college. Yeah, we just don't have New Zealand in the title. They did vote it, they didn't get up.
No.
They kept it Australasian.
Okay.
You're probably the one that's that one.
No, it isn't. It depends. Obviously, if you're really, really stuck from your lifestyle perspective, and you need to work in metro because that's where your kids are, it might be a bit tricky. But because you can, if you keep your skill sets very open, education, clinical, research, clinical, you will always have an option. Yeah. Yeah, so it is shift work, so I do evening shifts as well as day shifts. I'm not in the ED physically at night, but I'm on call. So I'm not physically on the floor unless there's obviously some critical patient that needs the attention, otherwise I am on call. Yeah. Okay. I think we have to wrap it up. Come and see us.